One of the greatest football coaches in history, Lou Holtz, said, "The best players don't always win, but those that play the best most always do." Commenting on that quote, Pete Carroll, one of the most successful college football coaches in the USA, said, "That's why we work so hard. That's why we train so hard. That's why we focus so much on practicing better than anybody's ever practiced before. To practice better than others, it helps to have more time and more energy than others. That extra time and extra energy come from not doing wasteful exercises in your overall training program, both conditioning and practice. They come from running a thoroughly rational, state-of-the-art training program, not a run-of-the-mill program where mental inertia rules and inefficient exercises are used because others do them. The greatest reserves of time and energy are usually in the conditioning part of a training program. This video shows a way of saving time and energy while improving both strength and flexibility. On this video, I do not teach typical gymnasts or dancers stretches that work okay for children and youngsters who are built for gymnastics or for dance. The exercises for simultaneously strengthening and stretching muscles that I teach are designed to deliver great flexibility for adults who were not born to be gymnasts or dancers. You might have a few questions, such as: why do stretches for adults have to be different from stretches for children? Why shouldn't adults use methods of increasing flexibility that are quite effective for children? Why do gymnastic stretches, which work so well for gymnasts, work so poorly for the rest of us? What stretches work better? Here are my answers. Even a cursory study of anatomy reveals that joints change with age. There are certain joint positions that a majority of children can tolerate, but for adults, stretching in such positions is ineffective, even harmful, and there are other positions that make stretches effective and healthy for adults. Here are examples of just the changes that happen with age. The angles between the shaft of the thigh bone and its neck, the part that ends with the head of the thigh which fits into the hip pocket, change with age. The angle in the frontal plane, called the angle of inclination, which at birth might be 135 degrees or more, decreases with age, and in adults it is usually about 125 degrees. The angle in the transverse plane, called the angle of declination, which at birth might be 30 degrees or more, decreases with age, and in adults it is close to 10 degrees. The greater angles of femoral inclination and declination let children abduct their thighs farther than adults can. These changes have to do with changing body proportions as humans grow. A deep back bridge requires well-retracted and depressed shoulder blades. That in turn requires a good extension of the thoracic spine, which usually bends forward and loses mobility as people sit for hours daily, beginning in school. Children's muscles and ligaments are more pliable than those of adults due to smaller muscle mass around joints and to age-related changes in the fibrous connective tissue. Gymnastic methods of flexibility training were designed for children, so they work best with those who begin their training before the age of 12 and poorly with those who begin past the age of 16. The later the training begins, the less effective these exercises are. There is a sport, however, in which all athletes display both great flexibility and great strength, even though very many of them begin training long past the age of 16. The sport is so strenuous and puts such a great load on one's joints that if they were not in the safest positions, they would be destroyed. That sport is